Hi, I'm AJ and I'm doing my comprehensive physical assessment. I apologize, I have to wear a mask. I've been really sick for the last week. So this is my patient. She's coming in today. I'm going to go ahead and start a head-to-toe assessment on her. She walked into the emergency department with a steady gait, and I'm going to go ahead and start out with a set of vitals. I've also asked her name and her birthday, which she verified with her wristband. Do you know where you are right now?
Yes, hospital.
Excellent. Do you know who the president is?
Oh, yes.
Okay.
Trump.
Do you know what day of the week it is?
Tuesday.
Excellent. So our patient is AAO times 4. She's alert and she's oriented to herself, where she is, the situation, and the time. I'm going to go ahead and come back here. Also, while she walked in, I was assessing a few different things, like her posture, which is appropriate. Her gait was steady. Her skin is appropriate, pink, warm, and dry. She's not sweating. She doesn't look disheveled. So I'll go ahead and take a blood pressure here. And that's going to squeeze really tight, but just for a minute. And then on your opposite finger, sorry to reach over you, I'm going to put this pulse ox, and that'll tell me your oxygen. And your heart rate, which I will also auscultate later on. And then I'm going to move your hair back here. This is your temperature. It'll just go right over your forehead and right behind your ear. So 36.3, that's a great temperature. Her affect is appropriate. Her speech is good. So all of those things look good to me. Her oxygen is 97%. I can bring this over here. Which is good. Her heart rate via the pulse ox is 94, but again, I'll auscultate that at a later time. And then her blood pressure is 140/99, which is a little bit high, but it's not really fair to get patients right when they first walk into the ER because they're a little nervous, so we'll reassess that at a later time. Alrighty. So I'm going to go ahead and reach back here and grab a pair of gloves. To start out, we're always inspecting before we listen or before we touch. So I'm just kind of giving her a look head to toe. We'll start with her head. Up at her scalp, I like to look at the hair and kind of assess for any alopecia, any infestations, any flaking, any rashes, anything that we might need to assess further, but I don't see anything, so I'm going to go ahead and just kind of look through your hair, which is nice and clean. Her scalp looks really good. I don't see any flaking or dryness. Her hair isn't brittle, so that looks okay. So then we can kind of move along. So I'm going to just look at her face. Her face is very symmetrical. Everything looks okay. I don't see any drooping on either side. I assess for any like drainage or flaking from her eyes, any flaking from her eyebrows. Her lips aren't cracked, so she doesn't seem dehydrated to me. No drainage coming from her nose or ears. But we can also kind of assess a little bit further. So to begin, you notice that she's wearing glasses. We'll go ahead and have her look at the Snellen chart, which will also assess the cranial nerve 2, which I had somewhere. Uh-oh, I lost my Snellen chart. Oh, there it is. Okay. I've got a Snellen chart. I'm going to stand 20 feet away from you, and I'll have you cover your right eye with your right hand. So cover your right eye with your right hand. Can you read this line?
DUFPOTUC.
Excellent. And then go ahead and put your left hand over your left eye. You can read that.
Can I read the lower one?
Sure.
LEFODPCT.
Excellent. So my patient's right eye is 20/20, and her left eye is better than 20/20, so that's great. And then the other thing I can do to assess cranial nerve 2 is to do a confrontation test. So I'm going to stand right in front of you. Sorry, I don't want to block this. Thanks. Okay. So I'm just going to check your peripherals. So I'm going to reach behind you and then bring my hands towards the front of you. Just let me know when you start to see them and I'll stop. So then the other thing that we can do is we can check cranial nerves 3, 4, and 6. Sorry. So for cranial nerve 3, I'm also checking her eyes, and we're going to do, shoot, I should have just left it. 6 points or the 6 fields of vision. So I'll have you just stare straight ahead at my finger and then just follow my finger. So we're going to go up and keep your head nice and straight. Diagonal, go lateral, medial, back to lateral, back medially, and then diagonal. So that looks great. I don't see any shaky nystagmus or anything to be concerned about, so I think that looks really good. The other thing that I can do is check cranial nerve 4, which is constriction. I might have to have you back up a little bit, actually. So I'll just do this with my pen light here. So I'll have you pull your glasses up on your head. So I'm going to check for the constriction of her pupils. So I'll shine my light in her right eye and assess for constriction in her left eye, and then shine my light in her left eye and check for constriction in her right eye, and then check for constriction in the eye that I'm shining. So I'm going to shine it in her left eye first. And a normal pupil is about 3 to 5 millimeters, so we want it to constrict down to 1 millimeter. So first eye, her left eye constricts wonderfully. Right eye constricts great. So now I'm going to shine my light into her left eye and check for constriction in her right eye, which is appropriate. And then in her left eye looking for constriction in her right eye looking for constriction in her left eye, which is appropriate. So that looks great. And then the other thing that I'm going to do is cranial nerve 6. So I'm going to take my finger, and you just look straight ahead and focus on my finger. Don't move your head at all. Okay, and her eyes align really good right there. So that looks great to me as far as assessing those nerves. And so I'm going to go ahead and just do a really quick down and dirty kind of eye exam as well. So I think this will reach far enough. So I'll have you pull your glasses back up one more time. And I'm going to shine a light in your eye. So I'm coming about, 45 degrees out from her. And I'm going to just assess for that. There we go. For a red reflex, which looks great. So then I'm going to come in a little bit closer so that I can assess back through her optic nerve, and I can look at some of the interior structure of her eye, which looks appropriate. And 45 degrees on this side. Sorry, it's a stretch. Looking for that red reflex again. Okay, which looks good. So I'm going to come in a little closer. Following the optic nerve back, and I can see some of the inside structures of her eye, which look really good as well. And then I'm just going to touch your eyes. So I'm going to look at the sclera, the conjunctiva, and I'm just going to make sure that everything looks okay. So I'm going to kind of pull down. So it's nice and pink. I don't see any drainage that's unnecessary. She's got nice white eyes. Her irises look good. So no concerns there. That looks great. So then we can go ahead and we can move on to her nose. So I'm going to look at her nose. It looks nice and symmetrical. I don't see any drainage coming from it. So I'm going to grab my light here and assess that a little bit better. You want to be really careful when you're assessing the nares because they've got very high vasculature, so you don't want to cause her to bleed. So I'm just going to kind of stick a little bit up there. So. Okay, nice and clear. Couple boogers. So that looks really good. And I know that we didn't need to, but we can actually go ahead and assess the olfactory nerve, which is cranial nerve 1. So I'm going to go ahead and have you close your eyes, please. And I'm going to brush something under your nose, and I just want you to tell me what the smell is, okay? You should know it very well.
Alcohol swab.
Yes, so I used an alcohol swab, which she got, so that's nice and intact. And then we can kind of move on to her ears. So I'm just gonna look and assess. I don't see any deformities. I don't see any calcium growths. I don't see anything coming out of her ears. The cartilage looks good. So then we'll kind of take a peek in her ear. You want to use the biggest speculum that you can to look in the ear just so you can get a better visual of that tympanic membrane, which is what we're looking for. So I'm going to look at the internal ear canal. I'm just going to pull up on her pinea. If she was a little kiddo, I'd pull down. And I'm getting a really good visual of that tympanic membrane. It's nice and pearly gray. Sorry, I know that tickles a little bit. Ooh, and we'll come over to this other side. I'm just going to shine the light right in there. Little waxier, it's harder to visualize that tympanic membrane. But everything looks okay inside. I don't see anything concerning. It's nice and pink in there. So then the other thing that we can do is we can assess cranial nerve 8. So when you assess cranial nerve 8, I will occlude your right ear, and I'm going to say 2 words. I'm going to whisper them in the side that's not occluded, and just tell me what you think those words are. And actually, you can go ahead and occlude. So take your right hand and cover your right ear.
Baseball. Tennis ball.
Perfect. And then take your left hand and occlude your left ear.
Hot dog. Hamburger.
Perfect. That's great. So that was assessing cranial nerve 8. And then what we can do is we can start to assess her mouth. We can just move down a little bit. So when she came in, I think you can probably check off cranial nerve 10 because she's been speaking. She's speaking appropriately. There's nothing that's very concerning to me about the way that she's. I'm sorry, this room's really little. Nothing concerning about the way that she's speaking. So when I'm looking, again, I'm assessing her lips. I don't see any cracks. Everything looks okay. So I'm going to look inside of your mouth. I'm sorry, this is a little more intrusive.
Super intrusive.
Ugh. Okay, so go ahead and open your mouth. So I'm just looking inside, everything looks okay, all of her teeth are intact. I don't see any lesions or anything that's concerning there. So that looks really good. Stick out your tongue and move it side to side. So that's cranial nerve 12, that looks good. And then I'm gonna test and also assess, I can assess her uvula and make sure that that looks okay, but I can also assess cranial nerve 9. I'm sorry. So open your mouth, say ah. Okay, so I won't stick it in very far. So her uvula is nice and centered. I don't see any lesions back there. I'm going to kind of stick this back a little further. Okay, gag reflex is good. So that's cranial nerve 9. Sorry. And now that everything looks okay as well, I'm going to go ahead and, as part of cranial nerve 10, just have you take a sip of water after the horrible. And just assess her swallowing. Swallowing looks okay. Awesome. Okay. So then I'm going to go ahead and I'm going to move towards her jaw and her neck. So I'm going to assess her lymph nodes, and we'll do just kind of a down and dirty assessment of her lymph nodes. So I'm just checking to make sure, you want them to be kind of little squishy, pea-sized nodes. You don't want anything to be hard. Any pain? Okay. And I'm also assessing too, I can kind of assess her trachea. I don't feel like goiter, trachea feels midline, so no concerns there. And then again to the lymph nodes. And then turn your head to the left. So these ones are a little tougher to feel. Turn your head to the right. Any pain? Okay, and I'm going to come right behind your head. Okay, so that looks okay. And then I'm going to also assess her TMJ, and that's going to be cranial nerve 5. So go ahead and clench your jaw. And I'm just feeling those muscles, feeling the temporal muscles here. And that feels okay. And then I'm just going to have you try to open your jaw against resistance. Okay. So that looks really good. And then I'm going to just have you, let's see, we'll assess cranial nerve 11. So go ahead and turn your head left and right. And then shrug your shoulders against resistance. Okay, that looks good. I think I'm missing one, but I'll get it figured out. Okay, so we can kind of move down and we can start to do our head to toe assessment. So while I have her sitting up like this, I can inspect her posterior. So I'm looking just for skin color, skin temperature. So she's nice and warm. I don't see anything concerning, no skin breakdown. Everything looks okay, no deformities, no tenderness in her spine, maybe a little tenderness. Okay, so that looks okay. And then I can do some auscultating as well. So I'm also assessing chest. Chest looks okay. We look for a barrel chest or any deformities or anything that looks kind of strange there, and hers looks very symmetrical. I'm seeing symmetrical chest rise and fall, and even regular breaths, so that's good. So I'll go ahead and auscultate her lungs and just make sure. So I'll have you take a couple of deep breaths for me here. Big deep breath. Good. I'm gonna reach kind of down here. Good. Good. Okay, and then I'm going to come around to her back. Big deep breath. Big deep breath. Big deep breath. Big deep breath. Okay, so her lung sounds were clear and even bilaterally throughout, so that was great. And then I'm going to go ahead and auscultate her apical pulse as well, so you can just breathe normal. Do we have a clock in here? I'm going to borrow your watch there. Real professional. Okay. Okay, so I counted for 30 seconds and I got 43 beats, which would be about 86 beats per minute. It was a little irregular, but that too we'll kind of go back and reassess in a little bit. So we've got those noises down. Everything looks okay with her chest and her posterior. I'm going to go ahead and do assessment of her upper and lower extremities. So I'm just looking first. I'm looking at her arms, making sure that there's no deformities. Everything looks okay. Alright, so everything looks good. She's pink, warm, and dry, so that looks good. I'm going to check her cap refill, which is less than 3 seconds, so that's wonderful. I'm going to palpate her pulses here. So they're nice and strong. I give her like a 2+. And I'm going to scooch up here. Sorry. So those are nice and strong. I'll give her a 2+ on that too. And then I like to check all the joints, so go ahead and stick your arms up and kind of roll your shoulders, and then kind of move your elbows, roll your wrists. Okay, and I'm going to have you squeeze my fingers super tight. Awesome. And then push up on my hands. And push down. Great, so she's nice and strong and with her upper extremities. So looks good, and then I'm going to kind of move down towards her legs. And same thing, we're just kind of looking, we're assessing and making sure. I'm going to have to look at your feet, I'm really sorry. Same thing, that the color looks good. That there's no, no weird patchy spots, no skin rashes, no lesions, no abrasions, no deformities, everything looks good. And then when she walked in with a steady gait, so I could tell that her, she's got full range of motion on both of her feet. I'll have you do this one too. Thanks, I'm sorry. I owe you. So then I can come down here and I can palpate. I don't know if you can see. Okay. Her tibial pulses, so I'll come down here. Those are nice and strong. I'll give those a 2+ as well. And then her pedal pulses. Those are nice and strong too. And then go ahead and lift your legs up towards the air. And then back. And then lift your toes up towards the air. And then down. Awesome. So that's great. And then I'm going to go ahead and have you lay back all the way here. So I'm gonna assess her abdomen now. So I'm gonna lean you back just a little bit. When was your last bowel movement?
Yesterday.
Was it normal for you?
Yes.
Okay, good. When was your last period?
Like a week and a half ago.
Okay, any chance you could be pregnant?
No.
Okay, perfect. So, here, I'll try to scoot this a little bit closer. So same thing with anything when you're assessing. We're gonna visualize first and just inspect. Make sure everything's centered. Make sure that she doesn't have like an ostomy or something. And then we always listen to the stomach before we palpate because you risk moving things around and having different sounds if you palpate first. So looking, everything looks okay. So I'm gonna go ahead and listen to her bowel sounds in all 4 quadrants. So you can just breathe normal. Okay, so she has hyperactive bowel sounds, which is great. And I'm gonna go ahead and flip my stethoscope to use the bell, and I'm gonna auscultate over the aorta, and we're just checking for any bruits. Which I don't hear, so then I'm gonna continue to assess the renal and iliac arteries, which are down just a little further. All right, so everything sounds okay, everything looks good. So now we can move on. So while I have her laying down, I'm gonna start with the spinothalamic tract test here. So I have a couple of tests for you. The first one is I'm going to take this cotton ball and I'm gonna make it kind of wispy. And I'll have you shut your eyes and I'm just gonna touch different parts of your body with it and you just tell me where I'm touching, okay? So you're gonna close your eyes. Elbow.
Hand.
And tell me which side too.
Right.
Perfect.
Left top foot. Right ankle. Neck.
Okay.
Left side.
Perfect. So there's my cotton ball. Sorry, I didn't realize the camera wasn't really facing. So I used this little cotton ball and she got that all right. So that looks good. And then the other assessment that I'm going to do is I'm going to use, I don't have the appropriate tool, unfortunately, so I do have to use a paper clip. So I'm going to use the paper clip for the sharp end and for the dull end. So I'll just have you feel with your hand. This is going to be the dull, and this will be the sharp. So I'll have you do the same thing. You'll just close your eyes, and then you just tell me if you feel dull or sharp. You don't have to tell me where it is, okay?
Sharp. Sharp. Dull. Sharp. Dull.
Okay.
Sharp.
And actually, while I'm down here, I can check the plantar reflex. So I'm going to take this. Okay. That's good. Okay. And then we can go ahead and do the, I can't say it right, the sterignosis test. So I have a few items that I'm going to put in your hands, and you just have to guess what they are, okay? Oh boy, do I have any items? Where did my items go? Okay, well, we can do this. Alright, so, I'm sorry. I've got a couple items. So this is one, this will be one, and this will be one. Okay.
Cotton ball.
Okay. Paper clip. Okay.
Chapstick.
Perfect. All right, that was awesome. So we got those just out of the way. So now we can move on to the Romberg test, and Also, we can assess her gait a little bit better. And we can check her cerebellar function, which I'll actually probably start with. So I'm gonna have you can put your socks back on. And then I'll have you sit at the side of the bed again. Sorry to make you move around a whole bunch. Yeah, we went, so these are grippy socks. So go ahead and sit here. So the first thing I'm gonna do is test cerebellar function. So, oh, so hard. Okay, so what I'm gonna do is I'm gonna hold my finger out, and you're gonna hold your finger and touch your nose, and then touch my finger, and you'll do it a couple times. So take your right hand, touch your nose, touch my finger. Again, again, again. And then use your left hand. Awesome. And then take your left hand, and then put your right hand on top of it, and then flip it as fast as you can. Okay, and then you can switch and take your right hand, flipping it really good. Excellent. And then go ahead and stand up for me. And you'll just take, let's see, your heel and touch it to your shin. Okay? Now touch it to your shin. And then I'm going to perform the Romberg test as well. So close your eyes and you'll keep your feet kind of shoulder width apart. Okay. And then go ahead and walk towards the camera and we'll just kind of assess. Just got a nice steady gait. You can come back. Excellent. All right, perfect. So now I'm going to have you sit back at the side of the bed. And the last thing I'll do is check your deep tendons. So try to pull this up a little bit. The first one we're going to do is your bicep tendon. So I'm going to pull your sleeve up on both sides. So we're just looking for her bicep to have a little bit of a reaction to this. There we go. So go ahead and just hang your arm down. There we go. All right, so she gets a little flexion right there. A little flexion right there. And then we're going to do the tricep, which will be on the back here. So go ahead and kind of dangle your arm. There we go. And then on this side. Okay. And then we're going to do the patellar tendon. So we're going to come right down here. And this is the funny one that you always see on TV. So scoot your butt back a little bit. So that is good. Okay, cool. And then the last one that we'll do is the Achilles. So you actually are going to take your foot and we'll flex it up just a little bit. And then I kind of go a couple of fingers, maybe like 4 fingers up from the heel. And then you just kind of tap her in the Achilles. So, so that one's good. And then scoot over. And I'm going to flex her foot up. The same thing, about 4 fingers up. There we go. So that looks good. All right. Ooh. So, last but not least, I'm going to go ahead and reassess her vitals as promised. So we'll do one more blood pressure. Ooh. Oxygen. Actually helping. So we have 94, which is great. Her pulse is high because she was yawning, she says. And her pulse on here is a little bit higher than it was when I auscultated it, which is a really good example for, well, now it's a little closer, but that's a good example for why you auscultate. And you don't always depend on your equipment, you always look at your patient first. Don't treat the monitor. And then obviously her blood pressure is much better, 132/77. just like I said, patients get a little nervous when they first come into the ER, so it's always good to reassess that last blood pressure. So that is my comprehensive head to toe assessment. Thank you for watching. That is all.